Very excited to have Gabby and Kayla here with us. Gabby is the director of Hippotherapy at Carolina Therapeutic Ranch in Rock Hill, South Carolina. Gabby's been a certified occupational therapy assistant for many years and brought Hippotherapy to Carolina Therapeutics in 2017. What started as one horse and 3 clients, right, has grown to 6 horses and over 20 clients. And Kayla is joining us too as a certified physical therapy assistant, also at Carolina Therapeutic Ranch. She joined up with Gabby in 2017 to start this program and quickly fell in love with physical therapy on horseback and is now exclusively practicing physical therapy at the ranch. And both Gabby and Kayla have several years of hands-on experience with Sanfilippo, and you'll see some photos in our presentation of the client that they see who has Sanfilippo. So without further ado, I will go ahead and start sharing our presentation. And I will turn this over to Gabby and Kayla to give their short introduction and get started.
Cool. Well, thank you guys for joining. We appreciate it and taking the time to be with us today. Like Cassidy was saying, Gabby and I have been doing this for a number of years now, and our sweet friend that we started working with, who had Sanfilippo with, I've personally been working with since June of 2017. And then about a year later, Gabby came on board, and that's when we started introducing hippotherapy with her in her sessions. So we've now been working with her for the last 7 years. She would see us in the clinic, and then she'd come out to the ranch with us, and now she exclusively sees us at the ranch twice a week. So we've been able to see her kind of through the years and through the progressions of things. We've been able to see her when she was at her hyper stage, where we were running around everywhere, to where now there are some days where it's a primarily stretch-based session, but that's something that we'll get into a little bit later. But we'll go ahead and kick off, and we'll start off by talking about the differences between hippotherapy and therapeutic riding versus adaptive riding, because they may sound the same, but they are completely different.
Yes, like Kayla said, they sound very similar, but two total different spectrums of what we are looking for. So with hippotherapy, we have to be a licensed therapist, whether it's a occupational, physical, or speech therapist. And our main goal is improving the function of the child. This is covered by insurance, and it is considered a tool to help encourage the sensory, neuromotor, and cognitive systems to promote a functional outcome. And we use evidence-based practice and clinical reasoning throughout our sessions. And then we are both trained through the American Hippotherapy Association, where we have both taken part 1 and part 2 of our courses. And that just kind of gives us a better understanding of utilizing the horse as a treatment tool in our sessions to then, facilitate a better treatment for our clients. Also with hippotherapy, it's a hands-on approach from the therapist. So depending on the location that you're at, it's either like a one-on-one, so one therapist to the client, or a 2-to-1, where it's 2 therapists as a co-treat to the client. So very hands-on, specific with that. Along with hippotherapy, the patient is not in control of the horse. We have staff members that will lead the horse around the arena, and then we, tell the staff what we want to see with the horse, and to facilitate something, different with the client on. And then also with hippotherapy, there is a weight limit. It kind of goes back and forth depending on location and the American Hippotherapy Association recommendations. It's kind of up to 20% of the horse's body weight, which includes the tack that is utilized during those sessions. Where our session, we stay more around 10% of the horse's body weight. And that just kind of helps the longevity of our horses and our body mechanics if we have to come into a situation where we need to pull a child or things like that, that we can maintain our body integrity so that we can continue to provide services on a weekly basis. And then also with hippotherapy, the child must be at least 2 years old to be able to receive this type of treatment tool for their sessions.
Yeah, and to kind of piggyback on that as well, what we like to reiterate to parents, and we'll be getting into this down the road as well, further in the slides, is that when it's a hippotherapy session, it's not actually hippotherapy. It is a physical, occupational, or speech therapy session. So there may be times where your child is not on the horse, especially for our Sanfilippo babes. Like there are some days where it's just not appropriate for us to be on the horse because their bodies can't tolerate it. And again, we'll get into that a little bit later, but that's one thing that we really like our parents and our families to understand, because we have some families who will come out and they'll say, well, why were we on the horse this whole time? We're like, because we're still doing therapy with your child, and the horse is just a tool that we would utilize, like a ball or a swing or, anything else along those lines. And we want the horse to be able to supplement the session versus be the main focus of the session. But then getting back into therapeutic writing versus adaptive writing, Gabby's kind of the pro on that one.
So therapeutic writing, or adaptive writing, they're kind of trying to switch the terminology over to more adaptive writing, because there is a lot of confusion with therapeutic writing, with some parents and facilities not necessarily being educated enough, that because it says therapeutic, they're thinking it's therapy and it's going to be covered by insurance, where therapeutic writing, adaptive writing is a self-pay recreational activity. So it's considered a sport for those children, for those kids. And it is taught by a writing instructor. And that writing instructor is teaching a writing skill to each one of their clients. So how to like steer, how to stop, and things like that. For most parts, for adaptive writing, you're in a group or like a semi-private lesson, and the teacher, the instructor is kind of just sitting in the middle, and projecting what they want, the horse or the rider to be able to do. You'll still have like a leader and sidewalkers, but like I said, the most focus is more of a recreational avenue for that.
I think we have a question.
And then, kind of going along with the weight limits, depending on the location and what they prefer. Typically, their weight limit is 150 pounds for an unbalanced rider and 180 pounds for a balanced rider. And also with adaptive riding, they are using your typical equipment, which is a saddle, stirrups, and reins, which with each session or lesson that they are in. Whereas hippotherapy, it kind of changes depending on what the therapist is kind of looking for in that functional outcome of that session. So sometimes they will incorporate a saddle if they want to kind of focus more on some leg strength, or if they want to work on some steering with their reins, but they were focusing more on the bilateral coordination, problem solving, more in-depth therapy terminology versus just, oh, the patient can, steer around the cone, and things like that. So you will see kind of with hippotherapy and adaptive riding that the saddle is utilized. However, the therapist is having a reason of why they're wanting to use that type of equipment, where adaptive riding is in every lesson, that's what they will be utilizing.
Yeah.
And also with adaptive riding, they have to be at least 4 years old to participate.
Yeah. And I will say with adaptive riding as well, if your child is one that can't hang on to the reins, they will literally adapt that lesson to your child. So it may be that the horse is being led around, they have 2 sidewalkers, and they're still on the horse. It's just not an OT, PT, or speech therapist leading it, and their goal isn't to improve their overall therapeutic function. So don't be discouraged if you're like, my kid's in a wheelchair, like they can't sit in, like therapeutic or adaptive writing is something you want your child to be able to do, because these programs are used to adapting it to that style. It's just not a technical therapy session, and the focus is the horse. The focus is not that therapeutic intervention that you would get utilizing hippotherapy as a tool. So we just wanted to reiterate that, just in case it is something, because we do have friends, not necessarily with their Sanfilippo friends, but with our other families who are doing hippotherapy. And if they get to a point where therapy is no longer justified, I don't know if that's the right word I want to use for it, but they're not making the progress that we're wanting them to see while they're out at the barn, we'll refer our families out to adaptive riding facilities so that they're still able to be out at a barn and they're able to do it in a more recreational standpoint versus it being a therapeutic standpoint.
Yes.
So we can go ahead and move on to the next one. So Many of you are probably thinking, what are the benefits of utilizing hippotherapy as a tool for Sanfilippo specific children? A big benefit is equine movement offers multi-directional input throughout the body, provided by the use of a saddle pad only. So for Gabby and I's program, we specifically don't utilize saddles. We have our friends sit specifically on a pad, and you'll see that in a picture coming up, because it allows us to be able to manipulate the child into a bunch of different positions that are more therapeutically beneficial to them in that moment versus having to figure out how to move them around a saddle itself. So with that, and with it being the multi-directional input, it's a great way to stretch out muscles of the legs. So if your babe isn't able to stand up very well, if they're always locking with their knees together, as soon as you sit them on the horse, their legs are naturally being stretched apart. So especially when your friends or when your children are in wheelchairs, they're constantly in this position and their hips are locked down tight. But that gentle movement of the horse will get them to stretch out and allow their bodies to move in better ways. And it also facilitates core activation the moment the child is on the horse. Part of that comes in because of the incredible neuromotor input that is provided. A horse typically walks an average of 100 steps per minute, which in a 30-minute session is approximately 3,000 steps. So again, think about your kids if they are wheelchair bound. That's 30,000 steps that their bodies are getting in such a short amount of time. That's immediately sending inputs up to their brain. And per the AHA, in just 5 minutes of walking on a horse, or just 5 minutes on a walking horse, represents 500 motor neuron inputs to the patient. So in a typical therapy setting, if the child's on the horse for 15 to 20 minutes, with equine movement being incorporated, it could represent up to 1,500 to 2,500 motor neuro inputs to the patient, which with Sanfilippo is huge. These babies need as many inputs to their brain as they possibly can. And what better way to do it in a 10 to 15 minute to even 25-minute session all at once. I mean, we've seen some great benefits with our sweet babe that we have out here.
Yes, absolutely. And like Kayla said, kind of from the beginning, we have been seeing Miss Kira for many, many years, and seeing her through her, more sensory seeking stages. So where we were utilizing the horse for a very long time because she just needed all of that input and regulation, to now where, she has kind of progressed where, she needs a little bit more of that physical, like PT side of things, to keep her ambulating as much as possible. And to, again, we always facilitating the core, no matter what position she is on the horse and things like that. So we just seen really good benefits. And the fact that we see her twice a week, and we are utilizing the horse for majority of those sessions, we have just seen great progress, and lack of regression for her, which is a huge thing for Sanfilippo.
Yeah, and we can move to the next slide so we can continue on with it. So other benefits, kind of like what we were touching on a little bit earlier, is that utilizing hippotherapy as a tool can be provided no matter the ambulation level of your child. So that's one thing that's really prominent with Sanfilippo friends, is that as things are progressing, they'll eventually get to a point where they are wheelchair bound. That does not mean that therapy stops. It actually means that we need to be in therapy even more. This is a picture that we have with Miss Sweet K, probably about 5 years ago, when we were able to get her up on her hands and knees. And that's like what Gabby was saying when she was in a little bit more of her sensory seeking stage of things. And so we were able to get her on her hands and knees, and she absolutely loved it. Now we've lost a little bit of that motor coordination to where she's not able to tolerate it. So we'll try to do quadruped and prone and things like that, where she's laying on her belly in the barn. And a lot of her sessions typically look like she's sitting sideways on the horse, because currently she typically collapses down to the right. And so if I can get her sitting on the horse in a certain position, she's sitting upright pretty much on her own. And so that is 10 to 15 minutes of her core engaging in an appropriate position that she's not having to think about. Her body's just doing it because of what the horse movement is providing to her.
Yes. And kind of going off of that, when they are sitting on the horse, it's fun. They don't have to think about, what their body is doing. Their body's just automatically adapting to the horse's movement. So it's just a great low impact way to get those, motor neurons moving and everything like that, where we see really good benefits throughout.
Yeah, one thing that's also super important for Sanfilippo friends is a lot of that extra movement through their hips. I know that in the beginning stages, they are running like banshees anyways, but when things start slowing down a little bit, one thing that we've noted is that it can help their bowel movements. And what better way to do it as at the barn, because when we have blowouts, we just hose it on down and it's good to go. So it's been really nice to be able to see that and being able to help her in those areas as well. So, and the other thing that is nice about being out at a barn and being in an outdoor setting is that it gets your kids out of a standard clinical setting. You all know it. We all know it. You guys are at doctor's offices all of the time, and our friends are so much more aware than we give them credit for. They know where they're at. They know where their surroundings. Gabby, I'll tell you a story here in just a minute. But in addition to that, it allows for real world challenges. When we're working with our sweet friend, Miss Kay, we're able to have her walking on uneven surfaces. We're walking on the grass. We're walking on the gravel. We're walking up a hill. We're walking down a hill. We're walking on sand. You're not going to get that in a clinical setting. And it's allowing us to challenge her body in those ways to where she's going to be challenged out in the environment and just kind of out in society. So, and also too, horses can be very calming. Like there's days where some days we might not be on the horse, but we might be up there and we might be petting the horse. We might be having the horse snuggle our kids. It seems to be really, really good kind of for their mental state as well. So, but as far as them knowing where they're at.
Yes. So a few weeks ago, Miss Kayla was out of town. So we weren't seeing Miss Kay as frequently as we'd like. Just because we didn't have the staff support to be able to support her for safety reasons. So when Kayla came back and Kay was walking down the driveway, her face lit up.
Yes.
She was so excited to see Miss Kayla. And even when she hasn't been here for a few weeks, like she knows where she's at. She loves, all of the animals and just being in this setting. So it just pulls out your heartstrings, when you think, she's not 100% understanding where she is, but
she knows.
She knows, and she's a little stinker sometimes about it too.
Yes. So we can go ahead and progress to the next one. Can we go ahead and move to the next slide, please? Perfect. Thank you so much. One thing that is critical, and I'm sure that Cassidy and a bunch of the other advocates for this program have implemented to you guys, is that you have to advocate for your child. If you're looking at getting them involved in a physical therapy or occupational therapy or even speech therapy session that is utilizing hippotherapy, vet your therapists because they need to understand the differences with Sanfilippo as compared to some of their other clientele. If you want to get into that, you're more than welcome to.
Yeah. And then, kind of like we mentioned at the beginning, to be able to utilize hippotherapy, being a licensed OT, PT, or speech therapist. And, even though it's not a regulatory board, the American Hippotherapy Association is definitely recommended to take part 1 and part 2 of their treatment settings, where part 1, you get the idea of what's going on. And then after you have some hours of practice, you can take part 2, where you're kind of diving in more to the treatment and clinical side of things and problem solving, all of those sweet things. This is something that is listed on the American Hippotherapy website to find a therapist. And it'll list, different therapists, and like you can search for your region and everything.
Yeah.
It is a kind of pay to play. So there might not be a therapist listed on there that is in your region, but just do some research. Make sure they're comfortable with working with, Sanfilippo, or they had experience. Just because, as they progress, they need a lot more support, and you don't want to kind of set everyone up for, some safety issues and things like that. So definitely vet who you're going to be utilizing.
Yeah. And with that, those providers should be aligned with your goals for the child. And if they're not aligned with your goals, keep shopping around, because these therapists have to understand that a lack of regression in their skill set is actually progress. A lot of therapists who are going through school, it is drilled into their brain. If your client is not making progress, then they're out of the program. They have to make progress. And we're like, yeah, not with Sanfilippo, sorry. But them maintaining what they've got is progress that is leaps and bounds ahead of anything that they could be getting. So make sure that you understand that as a parent, make sure that they understand it as a therapist, because if that is not lined up, you're not going to be getting the benefits for your child that they could be getting somewhere else with a therapist that understands that. And providers should also be aware of the inability for your child to self-regulate their body temperature. We're out here, we're down in the South. the summers are stinking hot, you know, and we are constantly monitoring Sweet K's body temperature. We're using cooling cloths, we're using fans, we're using the air conditioned bathroom if necessary, you know, because the last thing that we want for her to do is to be going into like a heat stroke situation. So if it's even like starting to whisper about being questionable, we're not on the horse. We're keep making sure she's cool. Like, it doesn't matter, like her safety is paramount. When it's colder, it's not as big of a deal, but we have heating blankets. We close the barn up. We're making sure that she's staying warm and that she's moving and she's staying active. But these providers need to know that that's something that they have to take very, very seriously. Because a lot of people aren't aware of that. They're like, oh yeah, they're not sweating, it's fine. We're like, no, that's not fine. Not at all. And they should also be able to provide maximum physical support for your child as Sanfilippo is progressing, right? I mean, a couple of years ago, we were walking and Miss K could be running laps all around the arena. Now she'll be walking great for 2 seconds, and then the next she's trying to drop to the ground. So if the therapists aren't ready and they're not aware and they're not 100% on their game 100% of their time, then it could be a safety concern. And they need to understand you cannot turn your back on these children. You need to be with them 100% of the time. On the ground, let alone when you're on the horse. Because we'll have days where Miss K is sitting up on the horse and she's doing great, and then she's trying to fling backwards into my arms, or she's trying to fling forwards on, or she's kicking around. I mean, she's just having the time of her life. I'm like, all right, babe, not on the horse today, please. But they need to be aware of that, because you can't be disengaged and be looking at everything else around you. You need to be involved with that child. And from a PT standpoint, I can't reiterate this enough. The therapist needs to know that stretching and gentle massage, especially to the Achilles region, is a requirement. You need to be doing it every single time that you see this child, whether it's for 5 minutes, 10 minutes, 15 minutes, it needs to be incorporated. I've been seeing Kay for the last 8 years, and we have been able to maintain her ankle range of motion between what we've been doing and the amazing support that she has at home. Because as soon as they lose that mobility and they're up on their tiptoes, their balance is compromised even more so than what it already is. So we want to provide them the best amount of support that we can to keep them mobile for as long as possible. So if their therapists are not looking at stretching programs, if they're not looking at doing that gentle soft tissue releases, it can compromise what's going on with your child.
Yes, and same with OT, you know, focusing on the upper extremities, your wrists, your fingers, you know, things like that. So, you know, kind of across the board, making sure that they are able to move as much as possible to help, you know, the caregivers as, you know, they kind of progress and things like that.
Yes. So. And then they can teach you guys how to do it as well.
Yes.
So we can go ahead and move to the next one.
So evaluating hippotherapy for your child and what a session might look like. So kind of like what we mentioned in the beginning, hippotherapy is a tool. It's just like using a ball, a swing, a vibration plate. It is not the basis for the session. It is just a tool that you use for, you know, the 10, 15, 20 minutes, and then you are then refocusing your session on a lot of functional outcomes, whether it's, you know, doing some other dynamics on sitting, whether it's, you know, your range of motion and your stretching, your strength, whether, you know, prone, quadruped, you know, the horse is not the end all of your session. And, you know, kind of like Kayla said, here in the South, it gets hot. Once it gets to a certain temperature, we don't utilize the horse. So then, you know, we have to do other things in our sessions, where we have a bunch of different, you know, activities that we can utilize to help assist with all those functional outcomes for our session. And again, being an OT, PT, or speech therapist is required for hippotherapy. And again, it's billed through insurance and things like that.
So, and then what a typical session can look like is that you need to understand, like Gabby was saying, that utilizing a horse is not always going to be incorporated in these sessions. Again, when it's stinking hot in the South, there's no way that we're riding. We're just going to be focusing on a strictly inside day session, you know, where we might be focusing a little bit more on her ambulation. We might be focusing a little bit more on stretching. It just kind of depends on what the tolerance level is for that day. And when the horse is being utilized, you need to understand too, they're not going to be on the horse for 60 minutes. And especially with Sanfilippo, you're going to get 10, maybe 30 minutes max if they're kind of at the beginnings of everything and they're going as things are progressing. they may only tolerate 10 minutes at a time. That's kind of our consistent time that we typically have Miss K on the horse for, because after that 10 minutes, you can tell with her body, she's just done. Her body is fatigued. Again, that's 500 motor neurons of input that's going into her brain in 5 minutes. So that's 1,000 in 10 minutes, and her body just gets fatigued, which is also great though, because then she's getting fatigued in a way that is challenging to her body and hopefully connecting some of those neurons that she may be losing. And one thing that we really want to reiterate, we don't have it in this slide here, but check your insurance plans.
Yes.
Because there are some insurances where even though hippotherapy as a tool has been accredited, I mean, it's scientifically based, there's all the research that's out there, there are still some insurances that will say it's a modality that is not going to be covered. And so in your therapist, when they're writing the care plan, and they put hippotherapy as a modality, if insurance companies see that, depending on the company, some of them will not cover it.
Yes.
So just know what your benefits are, know what the stipulations are, and talk with your team about it, because there may be some workarounds where either it goes to like a self-pay situation for therapy for that particular session. Just talk with your local clinics and see what's available to you.
Yes.
Some of them are a little bit stingy with co-treats as well. Like with Miss K, Gabby and I are treating her 100% of the time. Together, just because we found that's what benefits her the most. While I'm working on stretching her legs, Miss Gabby's helping her keep her trunk where it needs to be, so we can isolate the movements and make sure that they're being utilized correctly.
Yes. And like Kayla said, we co-treat her. So if a co-treat is not something that your insurance will cover, make sure you have another staff member that has some knowledge about Sanfilippo.
Yeah.
And can assist you with everything that is going on. So you really want to educate any of the staff members that are around you, and things like that. So that way safety, of course, is always number one priority, for everyone in the situation.
Yes. So, and we can move on to the next one. So if there's any questions for today, that's fantastic. If you guys are looking for more information, we've added some links on here. There's a frequently asked questions for families per the AHA page, and they're a wealth of information and a wealth of knowledge. So I encourage you to go and check out those links, as well as very specifically, if you're looking for what is hippotherapy, and if you have more questions there, you can go to that second link, and they define it very well there.
And before we get to those questions, I do want to highlight a slide that we have here that we want to hear from you. We appreciate the feedback, the engagement, the attendance, and people watching this live and recorded, and we would love to hear from you. So after we finish this session, we'll share the link and the QR code so that you can share your thoughts. Do you have a provider who would be willing to talk about their experiences with Sanfilippo? Is there a specific topic that's really important to you and crucial in your lives right now that we could, possibly put on in this webinar series? So, again, we really want to hear from you. You can email us here, contact@curesanfilippofoundation.org. Reach out to me. Here's my email and my cell phone number. And then I will stop the sharing and we'll get to some questions. Let's see. Okay, so I do have a couple of questions. How do I get involved? If I want to be a sidewalker, if I want to be a horse leader during a session, how do you get started doing that?
So that would be, finding a local, for the most part, most of adaptive riding and hippotherapy are done at the same location. So typically an adaptive riding program is already established, and a provider will come in and say, hey, I want to, utilize hippotherapy with my treatment sessions. And, they provide the horses and everything like that. So reaching out to those programs and say like, hey, I'm interested in sidewalking, or I'm interested in leading. Leading is a little bit more complex,
Yes.
because you are ultimately the advocate for the horse.
Yeah.
So having the background knowledge of horses, and kind of their personalities and understanding, if they make this kind of movement, what does that mean versus this type of movement, and just kind of being in tune with them, will make the sessions a lot easier. Sidewalking, kind of like I said, you want to be, trained and have some knowledge of Sanfilippo. So whether that's talking with the provider that is already kind of out there into seeing these kids, and, maybe just coming in on a Saturday or something and like talking through with them and things like that.
One thing that we do want to note is if you're someone who's like not familiar with Sanfilippo, if you're inquiring, you're looking at this at a later date, it is very physical. You're going to be walking outside in the heat. You're going to be walking on uneven surfaces with the sand. You need to make sure that you are able to keep up and keep yourself healthy so that you are able to be fully focused on the kid and the horse with what's going on in the session, because there's a lot of people who may have good intentions, but if you can't walk on uneven surfaces for 30 minutes in the summer sun, it might not be the best opportunity for you, but there's maybe other avenues for you to go ahead and search out as well.
Okay. So you don't need to be a physical therapist or a PTA, a CODA to do either one of those. You just need some hands-on training at the barn.
Yep,
Yes.
hands-on training. Yes.
Awesome. Okay. So then what is the role of the parent during the session? Like what do your parents do while the child's on horseback?
Go ahead.
So now, we have a swing set. And so when we are utilizing the horse during our treatment session, the parent is just kind of side watching, and taking pictures or, that kind of thing. We separate, for our setting is, the parents can watch when you're utilizing the horse. However, when we transition into the barn, the parents are not allowed back there, just due to the safety concerns where we have 7 horses in our area. And it's just a lot kind of going on between Kayla and I and the child. And then we already have a staff member in there taking care of the horses. And so adding a parent in there is just a safety concern. So typically they either stay out on the swing or they stay in the car.
And it's going to depend on which clinical setting that you're going to go into, right? Like there's going to be other barns that are out there that they have a viewing area where you're able to watch your child the entire time. For therapeutic or adaptive riding, you can watch your child the entire time. But the other reason why we're separating between the families and the child is some kids do better when their parents aren't watching all of the time. I mean, Sanfilippo is a little bit different in that avenue, but if we're trying to get the true therapeutic outcomes that we're looking for, sometimes we need to build that rapport with a friend. And if their parents are there 100% of the time, then they're running to their parent versus looking at us to what we're able to then provide for them. So that's another reason why we end up separating out. However, we always take time, at least Gabby and I, at the end of our sessions to go over everything that we worked on through the session. We're like, hey, this is the things that we noticed. These are the things that we're working on. These are the things that we want you guys to continue at home. So it's not just like, here, let's take your kid, and then here, we're giving them back. Like it's a very collaborative deal with the families. We just do want them to be able to watch their kids when they're, utilizing the horse, because it's a fun and it's a unique experience.
Yeah. And also, when we first, see them for our session, then again, we talk with the parent, how was their week, any challenges that came up. So it's something like, that might be something that we can try to assist and problem solve during our session if they're having trouble with something specific. And we can kind of, again, problem solve to help with that functional outcome, to be able to navigate the community a little bit better and things like that. So it's just a very big collaboration between the therapist and the parent.
So talking about problem solving things, how do you guys handle like your, child comes in for a first session. Maybe they've never been around a horse before. What does that look like? How do you navigate if they maybe have any horse anxiety or if they develop any anxiety on horseback? How do you handle that?
It really depends on the program that you're utilizing and depends on what their policies are, because everybody's going to have a different policy. Our policy, as we've been doing this now for the last 7 years, it's kind of rip the Band-Aid essentially, as long as it's safe. I think we've only had, in the 7 years that we've been out here, there's only been one child who has been truly freaked out about being on the horse. And at that point, it wasn't appropriate. There's a lot of other things that they needed to work through before they were able to be out here to work through these deals. Like they had to go see some counseling. They had to do other things that were beyond our scope of practice. But other than that, most of the times we'll have the families walk back for that first session. We'll introduce them to the horses, kind of see how the kids are reacting. We're like, all right, and now we're going to go. And we explained to our families, like, yes, it's probably going to be scary the first time they're on the horse. We are right there with them. We're always in contact with the friends. And within 2 weeks, sometimes it's 4, but usually it's within 2 weeks, the kid goes from screaming, crying, and like freaking out on the horse to like not wanting to get off.
Yes.
So it's one of those things where anything that's new and different can be scary, but we're just sitting there and we're encouraging them and we're just letting them know like, hey, we're going to be on, and as they're calming down, we're like, hey, this is good. This is great. We might not be on as long during their first couple sessions, but their tolerance slowly builds up. And we found it's just ripping the Band-Aid off. And within like 2-3 weeks, they're hugging the horse.
Yes.
And they're not wanting to come off.
So speaking of building that tolerance, like how frequent do you find these sessions are for children?
So, oh, you get to answer. I'm sorry, I'm not trying to take
No,
all
you're
of it. Again, that depends on the setting that you're in, right? It depends on what the insurance coverages are, especially utilizing hippotherapy as a tool. And it also depends on if they're getting seen in other settings, right? We have some friends who get OT at one clinic and they'll come out here to utilize us with hippotherapy. We have some friends who will see they'll be in the clinic at our clinics once a week and then they come see us. So that's 2 sessions a week. Miss K is unique because with everything that's going on with her, she needs to be out here 2 times a week, you know. So for you Sanfilippo families, if the clinic that you guys are going to has the ability to see them 2 times a week and they're not getting services anywhere else, we highly encourage you being able to work that into the program. We see her on Tuesdays and Thursdays, so I wouldn't recommend them going back to back to back because their body needs some time to recover. But even getting them out once a week is going to be great. Unfortunately, we can't do more than twice a week just due to the size of our program because we're only able to utilize a horse for 3 hours every day and they can't be back to back. And so we have to balance out which kids are coming out. So then we're not overusing a horse and they don't get burned out. So if we burn out of horses, we don't have a program.
Okay, so I do have one more question. So, and then there is a question in the Q&A that I'm going to read over and summarize and get that out there for you guys. One thing, I did hear you guys talking about the benefits for children in wheelchairs. So to clarify, hippotherapy is still a safe modality on the whole, you know, depending on your provider, I guess, for children who are primarily in wheelchairs?
Yes, it is encouraged to
Yes.
come. Even if they are wheelchair bound. Like Kayla kind of was mentioning, with the way that the horse moves, you are getting that multi-directional challenge, and you know the horse walks a specific way. So there's 3 different planes that the horse walks in, with anterior, posterior, lateral, or that rotational, just like our pelvis when we are ambulating. So getting them on that horse is going to continue to facilitate that movement of the pelvis and simulate the ambulatory gait.
Yes. The one thing to note though is if your child has complications with subluxation, where basically their hip is separating from the joint, there are specific contraindications for that as well. I think that if both hips are like actually out, like for you get a lot of your friends who have like spina bifida or things along those lines where there's no motor control, we have to be really careful with that. And so with our program, we have to have a signed doctor's note before we'll see a child. And that's just kind of an extra layer of safety. But for in general, as a whole, any of our kids who are in wheelchairs, as long as they don't have those specific contraindications, will absolutely benefit from being out on a horse.
Yes.
Let's touch on if they're not sitting straight up and they're leaning quite a lot, what are those like seating and safety accommodations?
Oh, okay.
This is Kayla's favorite part.
Yes, it is. It's okay. So when we first started seeing Miss K, she was able to sit upright on the horse. She was able to keep her body upright for the most part. There would be days where she was kind of leaning to the side, but we would change the movement patterns of the horse. If we do certain circles in certain ways, like velocity is bringing their bodies out to the side. Unfortunately, as things are progressing, there are days where she's literally like this. Today was one of those days. Obviously, if she's forward on the horse, then she's not engaging her body in an appropriate way, and in a way that if I'm max assist to keep her upright, it's not functional to be on the horse. However, we put her in side sitting. So what she's doing, she's literally sitting almost princess style on the horse. And what it's doing with Miss K, she collapses to the right. And so what we found is if we can position her to where her left hip is forward, it facilitates her body to be more upright. So I'm sitting there stabilizing her. I might have a hand underneath her armpit and a hand at her hip, but I'm able to keep her there with minimal assistance, and she's utilizing her body with the movement of the horse in that side sitting position. On days that are better days, Gabby and I've been able to put her back in forward sitting, and there's sometimes where we can last for about 5 minutes in forward sitting. And then there's days like last week where we're like, let's just try it. She did great in side sitting. We went to forward sitting and she was back forward.
Yes.
So we transitioned her back into side sitting, and that's how we completed our session. Yes. So if it's in a physical or occupational therapy setting and they are therapists, If they are not problem solving how to facilitate the horse in a way that is going to be productive for your child, they need to go back to the courses.
Yes.
And they need to be looking at how they need to be innovative in their treatment approaches. If it's therapeutic riding or adaptive riding, it's kind of hard because they're
Yes.
not looking at it from a therapeutic standpoint.
Yes.
But if your therapist is not looking at how to work with your child in that way, then quite frankly, they probably shouldn't be working with your child. It's okay not to have answers. It's not okay not to look for those answers.
Yes, and reach out, if, they are at, a hippotherapy, setting, reach out to other, maybe providers in that area that are incorporating hippotherapy, problem solve, with American Hippotherapy Association. People want to help your problem solve.
Yes.
And, come up, when you have these more challenging cases
Yeah.
to, get those functional outcomes. So
Yeah.
reach out and, network,
Yeah.
problem solve through that way. And I was going to say, along with what Kayla was saying with, being in a side sitting position, depending on which direction the horse is moving, facilitates something different as well. So Miss K sits with her left hip forward and she faces to the outside of the arena. So when they are facing on to the outside, they are working more of their extensor muscles. If we had her facing towards the inside, it's going to be more of a flexion pattern, which we do not want. So we always facilitate going to the left. And it's, that's what we do. And it might look different, if somebody's not trained coming in, they're like, you're just walking in circles the same direction over and over and over. That's what she needs.
Yeah.
That's going to give her the best outcome of our therapy session. And if we try to do too much, it just becomes more assistance from us and she's not getting the benefit of it.
Yeah.
Yes.
Okay, so that wraps up all of our questions. If any more come in, or if you're watching the recording and you do have questions for Gabby and Kayla, my contact information will be in the recording and in our Q&A document that we will share afterwards. Feel free to reach out to us. I am happy to get in touch with Gabby and Kayla again to make sure all questions get answered. So thank you guys so much. I know I learned a lot today, and I'm really excited to also share that we have a pre-recorded session that will be coming out for your provider specifically. So we'll be sharing that as well as this session. So if you have any providers that are interested in starting up a hippotherapy at their clinic or at their ranch, you'll be able to share that with them and get all the info that you need. So thank you guys again, everyone, for coming. Thank you so much, Gabby and Kayla, and we will see you next time.
Yes,
Thank
thank you
you.
guys.